Okay, you're welcome to today's tutorial. My name is Geoffrey Mtale, and I want to take this one to welcome you to this tutorial. And I want to thank you, first of all, for following my tutorials on YouTube and other platforms. Kindly, I request that you share the link to this tutorial to different people, different institutions, and to anybody that you feel would be in need of this content. So today we are going to be talking about slide background, and we have a few slides that we shall be going through and really get to understand what slide background is and how important it is and how we can apply the interpretation of different backgrounds in our daily practice, and understanding and having full knowledge of what cytopathology is. So for those who are interested in my qualifications, just down below there you can read for your own satisfaction and contentment. Yes, but let's begin on right straight away. So let's begin with the introduction. We really need to know what background in cytology is, or what background material is in cytology. So starting straight away, the background material in cytology, slide 1, reflects the environment that the cells were in before they were aspirated. That's one of the things that we need to reflect at, and this may be a representative, or it may represent the integral part of the lesion itself if it was aspirated, and at the same time it may reflect the secondary changes which would have come along with the lesion formation as a result of degeneration, as a result of inflammation, as a result of necrosis, or any other any other changes what would have happened in the cells in there. And these are all equally important, and they should be taken care of because they always guide us on how to make conclusions in regards to our evaluation of the slides. Due to the above, the slide background ought not to be really underestimated because it will guide us in a number of things. Well, we have other different issues and factors that we really consider when you're making our conclusion, but background appearance is also very important. So the slide background by itself may not reveal a diagnosis, but very often leads us to, or points to, a specific direction or a specific diagnosis. So it is very important to understand what it is. So for the background to aid in diagnosis, we must know that the preparation technique must be very optimized. And this is what I'm trying to say, that we know very well that for our results are always as good as our samples or how we process our different specimens in the laboratory and from the time of sample collection to the time when we report our results, all how we handle, how we prepare, and whatever procedures we take, they determine how good our and how reliable our results would be. So even in this case, the background of the slide that we intend to analyze, it must be optimized. In this I mean it must have the procedure of preparing the slide could have been done in a very systematic manner, so that what we see in the background should not be actually as a result of our mishandling of the specimen, but actually be representative of what actually is supposed to be, or representative of where the cells were before. For example, like if we are applying the aspirates on the slide, we really need to use optimal, not even optimal, but we need to not apply a lot of force, because when we apply a lot of force, when we are making smears on the slide sorry, we may end up rupturing these cells, and in the background we may actually think probably there was some necrosis in behind, but when actually it was a wrong technique of making slides, where we actually ruptured the slides and have them smudging and appearing necrotic. or mucinous in that case. So the slide background provides information about the origin of the sample, and it confirms the sampling area. If we are looking at samples, we want to confirm whether we have actually picked the sample from a representative position or a representative tissue or site, then the background also confirms to us that actually we have picked the sample that we are interested in. So continuing the introduction, the background always is typical of certain conditions such as caseous necrosis. So we shall look at how caseous necrosis is, and I believe when we reach there, we will appreciate that it is true. When you look at the caseous background, it is really pointing to typical pathologies that we shall look at. And then we have the mucinous, which is always common in mucinous carcinoma of the breast and the tick rate in the seminoma tests. And then we look at the tumor background sometimes, which provides clues which are beyond the cell morphology. Yes, well, we know very much that especially in cytology, we shall so much be looking at the morphology of the cell, the size, the nuclear cytoplasmic ratio, the integrity of the nuclei, then the appearance of the nucleoli and other features. But away from that, we also need to take note of the background or side background, which also speaks volumes in relation to whatever we are looking for in a slide. So inflammatory exudates in FNA, for example, this may serve as a safeguard against overestimating the cellular tipia, which could be associated with the regenerative processes. So in regenerative processes, sometimes we may identify some atypical changes, and atypical reactions in the cell when they are regenerating or when there are a reparative process taking place. So when we look at the background and then we have this in mind, it will give us a hint on how we should draw our conclusions, as such that we should not actually run so fast to begin imagining that we are doing with the atypical or pathological changes, but actually this could be as a result of repair and regenerative changes which are happening, which may not be malignant changes in the cell. So the presence of necrosis and cystic changes may provide clues to the stage of the disease, for example, in ductal in situ of the breasts. So we are going to be looking at a number of inflammatory, we are going to be looking at a number of background slides, and we shall have a list. If time allows, we shall go through all these ones. So we shall look at the cystic background, inflammatory background, the myxid, and finally we look at the stromal fragment background as we shall be moving forward. So moving forward, let's begin straight away and look at the cystic background. And in this we said a cystic background refers to the fluid content of the lesion, which may be presenting as a proteinous layer of variable thickness, in which former macrophages and other cells may be present. Actually, before we move forward with this, the moment you see former macrophages in the background, very many, actually big number of former macrophages, this is an indication and is pointing to the fact that actually the slide background you're looking at could be a former macrophage. Former macrophages, we shall look at how they appear, but just like you hear the word form, if you have looked about formed with soap, so they have in their cytoplasm the appearance which looks like a form. So that's why we call them former macrophages. Most of the time we find the macrophages are vacuolated because of those foamy appearances. We find the vacuoles formed in that. They are hypochromatic in nature, and then sometimes have either eccentric nucleus or the central nucleus in the middle. I mean, we shall actually look at them and then see exactly what we mean by from the macrophages. So if there have been any bleeding, cholesterol crystals may also be present, and this we shall see how these cryptos appear in rectangular forms. We shall also look at them. So the fluid may be integral part of the lesion, for example, like in breast cysts, congenital cysts, or cystic tumors, e.g. in papilloma, in the papillary cystic tumor of the pancreas, or it may be the result of degenerative changes within the lesion. So cystic changes within the fibroadenoma or benign nerve sheath or tumor may also be present. Actually, we can all see these cystic changes in fibroadenomas and then benign nerve sheath tumors. So one, we said in the beginning in our previous slide that when we look at the backgrounds, they can actually point to us and give us direction and on where we could be going. So when you see cystic background, you have to begin thinking in line with some malignancies and neoplasms which are actually associated with the cystic background. So cystic change is sometimes associated with the necrosis and may be one of the manifestations in the final needle aspect cytology slides. So sometimes we only not see cystic changes specifically, and maybe looking at the macrophages, the former macrophages, but in the background you may see some necrotic debris, some signs of necrosis, like having some neutrophils in the background, and some other cells like lymphocytes may also appear. So we have an image here which is actually indicating to us what a cystic background is. When we clearly look at this background here on this slide, we realize we have these cells. Can you go back? We have these cells you're seeing with the nucleus in the middle. The cytoplasm is pale, but this image may not be very clear where you're seeing this black arrow. But if you look at these cells critically, you realize they have a foamy appearance in the cytoplasm. I think let's look at another clear image talking about the same. Right, so here we are. This is very clear, and where I'm putting the cursor here, this is a former macrophage, and we have very many other former macrophages. We can see many of them. When you look in the cytoplasm of these macrophages, you can see the form appearance. This one here with a lot of articulation here. All these are former macrophages. So this is an appearance of a cystic background where you have former macrophages. We say they could be having, or they could have their nucleus in the middle, or they could be eccentric. Now, like when you look this one, the nucleus is almost in the center of the cell, but then we have others with the nucleus at the periphery of the cytoplasm, at the periphery of the cell. So looking at this side in the right, still we have very many former macrophages. We can see the former appearances here, and this is very really important to understand. Actually, if I can use a highlighter to mark out, we can see the former appearance. These are former macrophages, and in here we can see the vacuolations inside the cell here. And we talked about the location of the nucleus in the cells. So we have this one, the nucleus is located at the periphery of the cell, and then we have the former appearance in the cytoplasm. And then we have other cells where we see the nucleus actually almost in the center of the cell, and then we have the cytoplasm appearing to be forming. So this is a good illustration of how a cystic background looks like in regards to presence of former macrophages. So still in this slide, we can also look at another representation of how the cystic background can appear, and in this case we have cholesterol crystals. So these are cholesterol crystals, that we are seeing here, which are really showing the typical rectangular shape. So this, when you see this also in the background, when you examine your side, this also points to cystic background. Away from the cystic background, let's look at another background, and this is what we call the inflammatory background. So inflammatory ideally is coming from inflammation. So inflammatory background may be a representative of either the primary or secondary pathology in this case. So when you need, you have to consider other changes like the clinical information that you're always given on the lab request forms, and then you relate it with what you're seeing. You look at the patient's biodata. Also, it is very important to guide you on which direction you should take and in which line you should begin thinking. So inflammatory accidents need to be assessed as their predominant cell population in acute or chronic could be mixed. They may not be a same line of the cells. Like for example, we expect to have the majority of the cells to be neutrophils, but depending on whether it is chronic or acute, we may sometimes have mixed cells appearing in the background where we have the macrophages, like we indicated before, and at the same time we may have even lymphocytes also appearing and other cells of importance which may actually point us to what we really need to see. So inflammatory regions may have other components of the inflammatory reaction which may also appear in the background. By the way, in sometimes, depending also, we may also see not some necrosis in the background for that case, and we may also, depending on the site of where the inflammation is taking place, we may also have some mucinous appearance or some mucus appearing in the background. But overall, it is an inflammatory background. So inflammation accidents may obscure cell details and may explain changes seen in surrounding epithelial cells. So still talking about this, we need not to draw conclusion most of the time, but also take consideration in the background, because if you're seeing some moderate atypia and there is gross inflammation in the background, the background is very inflammatory, so we may not actually so much draw into the line of thinking about malignancies, but this could be changes which could be as a result of the inflammation taking place. What's this? So in the presence of inflammatory cell, the diagnosis of malignancy has to be made with caution, because we may actually end up taking inflammatory reactions to be malignant reactions, which may not be true. So here we have images illustrating to us what a typical inflammatory background can be, and on the image on the right we can clearly see these cells which are labeled with N. These are neutrophils, and here we can see the lymphocytes also appearing. I'm talking about the cell. This is a neutrophil, and in here we can see this is a large lymphocyte. So in the background, what we are interested in is to identify what an inflammatory background is. Actually, we can see even a large macrophage also here. There's a macrophage here, and then I can see another macrophage just right here in this background, and then very many neutrophils. We have a neutrophil here, and then we have another lymphocyte around here, and many other cells. So in addition to this, we can even identify some organisms here which appear to be with a clear margin. They are capsulated, so we can actually identify some organisms here. These organisms are capsulated. I think we have another one here. So this is typical of an inflammatory background, which actually could be as a result of the infection, like by, for example, with these organisms we're identifying here. And this, when we see this, we should not actually draw their typical changes in some of the cells and relate them to malignancies, but this is how the background helps us actually to identify and draw lines and not conclude. Though we know most of the time when we look in the cytological or smears, our major interest is to look at their typical changes and probably conclude whether they are malignancies or not. But away from the malignancies, there are other features that we also identify, like organisms and other material in the background which may actually look into other pathologies which may not be malignancies. So on our right, I think this one has very many neutrophils in the background. All these ones are neutrophils. This is a neutrophil. These ones are neutrophils, and then we have some small lymphocytes, just like we said in our last slide, that we can have a mixture of cells are appearing, and you will realize that in chronic inflammations, if the inflammation has been there for some quite time, we may have also a large number of lymphocytes appearing. So this one you're seeing here, this is a lymphocyte. These are lymphocytes here appearing, and then these ones are neutrophils also appearing in the background. So when you look, the background is dirty, and in the background still we can see like a necrotic appearance in the background, some mucinous appearance in the background. I can see some macrophages here. There are macrophages also appearing here. So this is typical really of an inflammatory background. So continuing, we say necrotic backgrounds, they represent evidence of cell death, and therefore they are always significant. And it may be part of an inflammatory process, e.g. in TB, or may follow a neoplasm. Like for example, in squamous cell carcinoma, and the inflammatory debris stain deposits, they appear like crushed cells, and other artifacts are not to be confused with necrosis. I really mentioned about this when I talking about the preparation of the slide, and also like we need to take care so that we cannot confuse ourselves in the end when we begin to look. So when you're making a smear and you're crushing cells, you're destroying them, they may in the end either confuse you when the background looks to be necrotic, or produce artifacts which may not be easily identifiable and bring a confusion in interpretation. So a necrotic background may sometimes obsessure cells that are still viable, and this is very serious. Sometimes, like in cervical cytology, you may really find when there are a number of necrotic cells appearing, like in inflammatory vaginosis, and these cells may obscure the nucleus of the cells, where we cannot draw conclusions, and in most cases such slides are rejected when you find that the necrotic background or necrotic substance is actually obscuring over 75% of the cells. Then we cannot go ahead. So in preparation of these slides, we need to take caution and take care of how we prepare so that we cannot make our slides not fit for analysis. So in the case of abscess or carcinoid necrosis in TB, a necrotic background may be all that is seen in the slide. So special stains like Zn for acid fast bacilli may be helpful to conclude on what the cause of necrosis could be, because when we stain, actually we'll see the bacilli in the background. So here we have an image which is representative of a necrotic background, and in this, if I can put my pointer back, we can see a number of lymphocytes. So we have the lymphocytic background here. All these ones are lymphocytes, and then we have this necrotic background appearing in the background of the cell. We have these features here appearing which look like mucus. Actually, when we look in the background of the cell, of the slide, it is not clean. This is a dirty background and made dirty with the debris which are characteristic of necrosis taking place. So this is one example of a necrotic background. I think we appreciate that. And then we have also another example of necrotic background. And when we look here, we see, and this is histology, but for purposes of understanding, I chose to put this here to help us understand very well. So I want us to look at some areas like here where we are saying it is a little bit pale, and then we have another area here where the pointer is. When you compare, the chromasia here is not the same as here it is hypo and here it is a hyper. But the most important thing here, when we look in this tissue here where there is necrosis, it is caseous in form. It looks like something was digested around this part of the tissue, around this part of the tissue, around this part of the tissue. So all this is a necrotic tissue appearing. And when we come to cytology, we see really necrosis also appearing. We see the margin of the cells not appearing well. There is, like if we look at this area, we cannot easily identify a cell yet here there, but the cell looks to be digested or degenerated, and all these are necrotic reactions. And the background, we can able see it is necrotic. If we take an example and look at this area where I'm covering, this is a necrotic background, a typical one. So this is how they appear. Away from that, we go to another background. This is what they call the myoxide or the mucinous background. And we say myoxide and mucinous background are seen as byproducts of some tumors or as reflection of degenerative changes within tumors. For example, we may find such backgrounds in polymorphic adenoma. We find them in mucinous adenocarcinomas, in mucoepithemodermal carcinomas, and then special stains can be used. For example, the pus can be used to confirm the presence of mucin. We all know that pus is a stain of choice if you want to identify mucinous depositions in the cells or in the tissues. And this is very important even in this case if you want to confirm the presence of the myoxide background. Once we stain, it will stain red, and it will be a confirmation of the presence of that. So in this image we have an illustration of how a mucinous background is, and in this background we have the mucinous background in a fine needle cytology smear from mucinous cytodenoma of the pancreas. So we look at the epithelium is sparse. So we have the mucoid or the mucinous background appearing. We can I think this is a clearly seen. Even I think I can pick my pointer here and then we begin looking. So we look at the mucinous background. All this is mucin which is appearing. All this is mucin. Yeah, so this is very typical of a mucinous background. And these mucin, sometimes they can also obscure cells and they render our slides unsatisfactory for evaluation in some cases. Secondly, when we look at the general background of the slide is not clean. It's dirty for that case, and with a lot of substances in the background, which doesn't make the slide look look good. So away from that, when we get to other images also showing us what the myoxide background is looking at, or the mucin background looks like. Still, let me get my pen and then we look at this. So when we look at this background, let's move away from the cells, but when we look at this area around here, we can see the mucin or the mucus for that case, if we can state like that. All this, the background is not clear, but we have a lot of mucoid or myoxoid background. We see a lot of mucus appearing. So all this background is mucoid. All this is mucoid background. And still, when we come to this slide next here, we have a lot of mucus depositions in the background of the slide. All over, we can all see all this. So this is a typical illustration of the mucoid background at the same time. So away from that, let's go through and look at the lymphoid background also. So in lymphoid cells, usually represent a chronic inflammatory exudate or a lymphoma. And this is a very good point to note when you're really drawing lines between the acute inflammation and then chronic inflammation. It's very important to know the type of cells you're seeing. You realize that in most cases in acute inflammation, you'll have very many neutrophils actually taking the biggest percentage in the slide background. But in chronic inflammations, you'll have very many lymphocytes actually appearing. But we say, however, lymphoid cells in the background is a feature in some other conditions. Like, for example, it could be an example of Warthin's tumor or a seminoma, and you'll find most of these tumors, like Warthin tumor in the salivary gland, and it could be also an indication of the nasopharyngeal carcinoma. They could be found in medullary carcinoma, but in all these cases, the lymphoid cells may help define the entity. So when you see a number of them, you have also to look at the background before you make conclusions in relation to malignancy. You need to take conscious of other conditions which may lead to having a lymphoid background. The image here, this is histology, but for appreciation and appreciating how lymphoid cells may appear. That's why I chose to put it here. So in this image, it's not quite clear, but we under higher magnification, we would be able to see clusters of lymphoid or cells, which are very many here, and you can see all these are clusters of lymphoid cells. They could actually appear in clusters, or they may appear singly, but this is a typical lymphoid background. So when you get to cytology, which is in line with what we are actually talking about, we can now appreciate the lymphoid appearance of the background in this case. So like, for example, here we are seeing a big cluster of lymphoid cells. All these are lymphocytes appearing, and then we have those which are appearing singly. This is a lymphocyte here, we have another lymphocyte here, and we also have another lymphocyte here, and many others, just like you can see in the background. So this is also a typical example of how a lymphoid background appears, and this could also help you to make your judgments well. So we have another image here where we have the close-up view of two lymphocytes in the center, and typically this is how lymphocytes will appear, and it's good to appreciate their shape and their morphology so that you make conclusion in the background. Still continuing, we have an example of medullary carcinoma where we look at the background. Power's gone, I think. Okay. Okay, continuing, sorry for that interruption, but continuing with our discussion about lymphoid background. Like in this case, you realize that we are looking at the FNA of medullary carcinoma of the breast, which contains a prominent lymphoid cell population in the background. So this is very clear. Actually, if I can put my pointer back, and then we begin, we see a very huge uh, representation of the lymphocytes. Actually, in every area we see very many lymphocytes, and this is a very clear illustration of how a lymphoid background can appear. And in this case we are looking at this in a population of lymphoid cells appearing in the medullary carcinoma of the breast. So some of these backgrounds can also be very important, just like I said, as we look at drawing conclusions on what the type of the cancer could be, its location, and its state. So away from that, we can go ahead to look on another background slide, and this is what we call the colloid background. So colloid background, this is commonly found in goiters and benign lesions of the thyroid gland that involve a diffuse or nodular pattern in that case. So normal components of the thyroid aspirate are primarily comprised of follicular cells and colloid. So intact follicles exhibit a spherical configuration, which with the centrally located colloid, and we shall see this in our subsequent and appreciate these statements very well. So colloid goiter has been classified as non-toxic goiter according to the updated international classification of disease. And colloid goiter is also known as endemic goiter, simple goiter, non-toxic and nodular goiter, non-toxic multinodular goiter, or nodular hyperplasia. So in this, what we are saying, when we talk about colloid background, it is very common. It's not that it only appears in goiter cases or in the thyroid cytology, but it can appear anywhere, but is very prominent. It is very common when you're looking at the thyroid cytology where goiter falls in. So we shall be seeing how this appears, but they are benign lesions in the first case, and however on ultrasound image they can mimic malignancies. So when you look through at the image done by ultrasound, it may actually look malignant, but on looking at the individual cells and looking at the cytological analysis of the tumor, we actually find out that most of the colloid tumors are actually benign. That's why we call them most of the time regard them to be non-toxic, endemic, because they are not malignant at that case. So architecturally, we find that microfollicles predominate in benign aspirates, while microfollicles, which are composed mostly of about 15 or fewer follicular cells, in a tight spherical configuration with a scant central configuration with a scant centrally located colloid absent or minor components. So we shall look at this image, and this is a follicle. We have been talking about the follicles, nodules of the thyroid gland. So typically we are looking at cytology of the thyroid gland here, and then we can see these follicles with the follicular cells actually surrounding. They are really arranged very well, and then we have the central colloid here. This is where we find the colloid placed in the center. So this is an intact benign follicle with intact follicles maintaining a three-dimensional spherical and regular spacing of follicular cells around a regular core of the colloid. So this is a colloid here. The cells are really okay. There is no atypia here, and this typically looks a malignant image. We have a lot of colloid appearing in the center here, and this is typical of what we call a colloid background. So, and in In air-dried smears, they may actually appear differently. So you can see that on air-dried smear, we see the colloid often appears as a sheet of metachromatic translucent material with characteristic cracking, or which may look like an artifact likened to a broken stained glass. And this is typical of what we can see in this image here and even on our image on right. This is colloid which is appearing in the middle, and this is for the case of an air-dried slide, and that's how it appears when it is stained in that case. So we have another illustration still. This is an expression of a benign colloid nodule, which will yield abundance of colloid, and it is either thick colloid as illustrated here or thin watery colloid. So still we can see the thick colloid also appearing in the background, and yes, this is a very good indication of and interpretation of what a colloid background could appear like. So away from that, we have the eosinophilic background, and this may appear in globules, and we said this is made up of eosinophilic globules surrounded by epithelium. In the cases of adenoid cystic carcinoma of the salivary gland. So these are examples. We don't really intend to mean that they are only found in the salivary gland, just like we talked about the thyroid in the colloid background, but they are very common there, and it is easy to come along them when you're examining slides from those or tissues or from those sources. So looking at the eosinophilic globe background, we can easily identify the eosinophilic staining in the background here, and we can appreciate. So we can see this staining here in the background, and this is what we are referring to as eosinophilic background. So the eosinophilic background globules which are surrounded by epithelium. We have a lot of epithelial cells that we can actually appreciate. These are epithelial cells which are surrounding the eosinophilic globules. All these are epithelial cells. We can really appreciate that these are epithelial cells based on their shape. They are polygonal in shape when we look at them, and they are cyanophilic in staining. So all these are features to really make us appreciate and confirm that these epithelial cells which are surrounding the eosinophilic globus, which are characteristic of eosinophilic background, and just like we said, they could be found like in adenoid cystic carcinoma of the salivary gland. But just like I said, doesn't mean that that's only where we can find them, but we can easily find them in such tissues. So away from that, we look also on another background, and these are the Samoma bodies. So Samoma bodies, these are very cardinal features, and just like we mentioned earlier, that some background appearances point to some malignancies or to some conditions. So sometimes there are some backgrounds which are very prominent, like when, for example, if you looking at the Cytology slide, Cytology, and from nowhere you land on the Samoma body. So this is just a confirmation of thyroid papillary carcinoma. So some of these features and these backgrounds are very important when we are making our slide examinations and concluding on the diagnosis that we really come up to. So some more bodies, we see these are seen in serous adenocarcinoma of the ovary, and then they are also very common in the papillary thyroid carcinoma. Actually, when you see a Samoma body, when you're examining a thyroid smear, it's just a confirmation of the papillary thyroid carcinoma. And then they could also be found in meningiomas. To really appreciate more about these features, we have samoma bodies, and these are concentrically laminated calcified structures derived from the infracted tips of the papillary structures, of tips of papillary structure, which are commonly seen in papillary carcinoma. So what we are talking about samoma bodies, actually, if I can get my pointer back, and then we appreciate. So this is what we are calling a samoma body. We can see the concentric lamination, like a circles appearing in here. Yes, when we look, we can see the concentric lamination is here. So this is what we are calling samoma bodies. These are samoma bodies. They can be big and sometimes they can be small, but they have their distinctive appearance. Like when we look at these concentric laminations, actually this one is very clear. You look at this, and this gives us a very clear picture of what a samoma body is, and the same thing happens here. So on air dried smears, they often appear as poor staining with variable sizes. They could be having nodules, although the concentric rings may easily be appreciated in diffquick appearance. Diffquick staining. So we have still other variants of these samoma bodies. Like in this image, we have now the different sizes. Here they actually are small, but all these are samoma bodies. We can appreciate the presence of samoma bodies. These two here are samoma bodies. So some are big and others are small. Even these smaller ones, you can see here, these are all samoma bodies. So looking at this is background is typical of samoma body background. We can really appreciate seeing these samoma bodies here. So on our left, we can see samoma bodies which are seen in aspirate from variant occasion, accompanied by fragments of fibrous cytoma tissue in diffquick staining. Like we said, they are appreciated well in diffquick. And on the right, we can see samoma bodies which are illustrated here and are closely approximated to follicular cells that demonstrate a squamoid morphology. So these are follicular cells. Actually, this is a cluster of follicular cells, and I want to just imagine that this is a follicular. These are follicular cells of the thyroid, and the moment you see samoma bodies appearing in these follicular cells of the thyroid, so that would be just a confirmation of the papillary thyroid carcinoma. Once you see samoma bodies appearing, I can actually see a samoma body here. I can see some concentric rings and appearances, so that's an indication of a samoma body. So going further, looking at probably what is going to be our last background as we conclude this tutorial, we are going to look at the cartilaginous debris or the cartilaginous background, and these are found in epidermoid cysts, and they could also be found in lymphoepitheliocysts, and these may contain variable degree of cartilaginous debris and inflammatory cells, but usually does not contain necrotic background in that case. So the aspirate contain occasionally cholesterol crystals and classifications as we shall look at them. So in this background, if we appreciate how keratin stains, keratin is most of the time somehow eosinophilic. It will stain orange, and this is how we always identify keratin staining in the different cells and the different backgrounds. So we can see a keratin background here with the, if you can follow through what I'm highlighting, all this is a keratinized background. So this is a cartilaginous background. So in this background, the cartilaginous background, this in the case, for example, of epidermoid cyst of the neck, where a patient had a history of surgical excision of a neuroblastoma in this case. So this is what we actually refer to as a keratinous background. Well, it could actually appear with some other cells. In this case we don't have them, but we may even have some neutrophils appearing, but not so many of them. And in this image still we have a keratinous background, and we can really appreciate this. We can see the keratinized background. So in the stroma fragment, in the shape of a leaf, may sometimes be seen in the breast fine needle aspect cytology, which could be suggestive of the pylori tumor. So this brings us to the end of our presentation today. I just thank you for sparing your time to listen and for following my YouTube channels for different tutorials. I encourage you that you share these slides with people who may need them, and subscribe. Don't forget to subscribe to this channel so that you get to know when other new slides are actually presented. Okay, thank you, and goodbye.